everyone, and welcome back to another episode of Kitten Lady and Friends. It's my interview series where I'm talking to some of the most fascinating people in cat welfare about what all of us can do to make the world a safer place for felines. I want to thank Royal Canin for partnering with me as part of their continuing Catology series. Super grateful to them. And I want to remind everyone, as usual, I have my kitten cam up. This week, we are joined by a mama cat and her lovely 5 little neonatal kittens there. And I'm super excited that we have these little babies we can watch today. It might be a little distracting because they're so sweet, tumbling over mom. I'm really, really excited we have these little ones with us because the subject that I'm going to be talking about today is veterinary care for the smallest and most vulnerable of our feline friends, neonatal kittens. My guest today is Rachel Wallach. Dr. Rachel Wallach is a veterinarian. She is the co-owner of Oaks Veterinary Urgent Care in Agora Hills. She's also a board member of my nonprofit, Orphan Kitten Club, and she just so happens to be the friend and veterinarian that I go to for just about everything kitten. She has helped me with some of my most challenging cases. She does absolutely beautiful work with rescue kittens of her own, with other organizations, and of course with my fosters. So I'm very, very grateful to her. Before I bring her on, I want to show you a little clip from a segment she was just on Animal Planet's My Cat from Hell. Let's take a look at all of the great work that Dr. Rachel is doing right now in this clip.
I'm really excited because I get to meet up with one of the many heroes who have raised their hands during this pandemic. Dr. Rachel opened her doors to this overwhelming number of abandoned and injured animals when others were forced to turn them away. Yeah.
Hey.
What's up, Dr. Rachel?
My name's Rachel. I'm a veterinarian. I spend my day treating sick animals and rescuing animals.
As soon as this pandemic hit, it was the most 4-alarm fire that I've ever heard.
That's when we decided that we were just going to say to all the rescues and the shelters, the answer is yes.
How many animals do you feel like you have actually helped?
I would say close to 400. Animals just started piling in. The main goal is to take on the special needs because I believe that there's no such thing as unadoptable.
I really do feel animals have hope thanks to people like you. Thank you.
Yay! I'm so happy to have you here, Dr. Rachel. Welcome.
Thank you.
I'm so excited to have you. So I guess I wanted to start with getting a little bit on your background because something that is a big frustration for those of us who foster kittens is that it is really hard to find a veterinarian who has that expertise in these young neonatal kittens. I want to know, how is it that when it's so difficult to find a vet who understands them, you have such a strong background in that? How did you get started? What was your kind of inspiration to focus on these little teeny tiny guys?
That is a good question for sure. And I think probably the driving force behind that is I have always been obsessed with cats. And I've also always been obsessed with, that's 11-year-old.
I love that photo.
And that's the first litter that I ever bottle fed ever.
Oh my gosh. How old are you there?
11. And I was really introduced to TNR, and those are my first 2 kittens I got from that litter. So yeah, I've been able to tame the hair a little bit since then. But basically, I've always had this obsession with cats, and and babies of any species, really. I don't know why babies are cute, and probably so their moms don't kill them. And well, it's true, right? They're so needy. They're so difficult to care for, and they're basically completely dependent upon somebody else, it would have to be super adorable. So at 11, I had this encounter with a woman whose backyard crossed my backyard. So we had these big backyards and then like a ravine in the middle, and then the backyard sort of met. And I was wandering around outside because that's what I used to do when I was bored. And used to just look for animals. And I found her backyard, and she had all these stray cats in her yard, and she had all these sort of makeshift shelters set up. And her name was Mrs. Ryder. She was from the Caribbean originally, and she used to TNR all the local cats if she could. They're definitely cats that she couldn't catch, and the one that she specifically couldn't catch, but who used to abandon her babies all the time, was Rusty. That was the mom of my kittens. And so literally I would like go every afternoon after school and help feed cats and just learn care and learn about petting them and behavior and working with a scary scared population. And then when Rusty was about to pop, I spent every day scouring the ravine and just listening for kittens. And then so that was my first bottle feeding experience when she did end up leaving them. And then from there, I was obsessed, and I just was like, I have to work with kittens. And when you're 11, no veterinary clinic will let you work with them, and you're not covered under insurance. And so a rescue allowed me to socialize feral kittens by keeping them and just working with them. And so that was sort of my introduction to kittens from more of a medical or treatment standpoint. And then it just sort of blossomed from there. And as soon as I got out on my own, and stopped hearing you can't bring these things home, then it sort of spiraled a little bit.
What was your experience like when you were in school and then coming out of school? How is it that you've been able to get the experience that you have?
It's really just having personal interest. Yeah, that's the vet school I went to at the University of Glasgow. It's having personal interest in finding people who have similar interests, and reading, a lot of reading, and then a lot of doing. Yeah, that was my first experience.
That's not a kitten.
And so it's close. Just kidding. She has mastitis, actually, that sheep. But so, you learn about 6.5 core species. I say half because chickens sort of make up part of the curriculum. And every vet school is different. Graduation day. It's great. And, if you decide that you have an interest in something that is a current specialty, then you can go specialize. But if it's not a current specialty, which neonatal and pediatric medicine isn't currently, but I'm hoping that we're all working towards making it its own specialty. Then it's really about doing your own learning. And so that's where I have developed most of my skills, and also from taking risks, because you have to take risks when you're sort of trying to carve out things that people don't necessarily know the answers to.
Sure. Yeah. Oh, well, I'm so grateful that you do the work that you do. And, I think that finding a vet who really understands this population is really difficult. Do you have any advice for people who haven't found a vet like you? How can people find somebody who has this passion and also has the medical background?
I mean, I think part of it is asking vets in the area. Most vets in the area will know a vet who has a particular interest or passion. Um,
Mm-hmm.
Again, it depends on the community that you live in, but I would say most vets in the area know that I have an obsession for rescue and an obsession for neonatal and pediatric medicine. So, and
Cool.
again, I mean that comes with doing the work and putting the time in, but I think asking veterinarians, saying, "Do you happen to know of someone who has a particular interest in or who tends to be drawn towards neonates or kittens or however you want to phrase it?"
You're a really good person to go to, not just for treatment, but also for kind of helping me and all of your people that you work with understand like what's really going on physiologically in the body of a kitten who's going through a medical condition. That's what I'd really like to kind of focus on today is some of the common experiences that foster parents like myself go through and sort of understanding like what's really going on here when they're experiencing this. So I wanted to start actually with the kittens on the kitten cam right now. These little guys, when they came here, were such a hot mess. And you know the type, the hot mess type. They come in and, you know, these guys were covered in fleas and they had fly eggs all over them and they were cold and they were emaciated and they were dehydrated and they, you know, were orphaned at the time. We've been able to locate mom, obviously, since. But something I wanted to ask you is, can you kind of talk about when you get these hot mess kittens, like what are the first things people should be thinking about? And then when you have all of these different things that are going on with them, I think it can feel overwhelming to especially somebody who doesn't have experience with critical kittens to know like what do you do first? Like do you know, you want to feed them, but you also want to get the bugs off of them, but you also want to get them warm. And, you know, since you come from this strong medical background of understanding really like what it takes to get a kitten from critical to healthy, can you talk about what people should be looking for? And then also, you know, what's the correct order of operations when you take in these little critical babies?
Yeah, absolutely. So, I'm total dork and I wrote notes. So if you hear pages flipping, that's what it is, okay? Um,
That's great.
I just wanted to make sure that I wasn't missing anything, although I'm sure there's lots of things that we won't cover. But, you know, when you get a baby in, and I have the same sort of excitement, animal control walks through my door and I'm like, what is it? You know, and I'm like hoping it's something really exotic or it's a kitten. Um, you know, so my first thing is like, oh my God, I gotta warm it up and I gotta snuggle it and I gotta do all these things. But, you know, really what I need to do and what I do remind myself to do once the sort of initial excitement dies down a little bit
So the first
is
thing is kiss them.
I, so this year is the first year ever in my whole life that I got ringworm on my face. So I
Lesson learned.
no, but I think I kissed a little bit less or a little more cautiously. But yeah, first oohing and awing. But then what I try to do is I try to take a really structured approach to how I assess them. Because if I do the same approach every single time, then I won't forget something. And I think that's really critical for people is that if you take an approach where you're like, okay, I have to do these four things and I always do it in this order, then it becomes muscle memory and you just do it and then you don't miss things. So for me, I collect the parameters first. You know, first I just look at them, and that's a really good thing to do. You know, you especially can look at a kitten and you can say, oh gosh, I can tell this kitten's been starving. Yeah, you can tell that, you know, that one's got a very angular jaw. It's very skinny. The umbilical cord is on, but it's nice and dry. So I'm looking at different things and just assessing the general state. And, are they breathing fast? Are they breathing normally? Are they moving around? Are they screaming? Are they covered in feces? That kind of stuff. Hey, Coco. And then I start to get the vitals. And so the big one for me, is temperature. The first one is temperature. God, that kitten is cute. But yeah, you can see how angled that face is right there. And that's part of how I assess, has it been eating properly or fed properly? That kitten is while it looks in good condition overall, it's clean. You can see that the skin is quite wrinkly on the underside, and that can speak to dehydration. The cheekbones are quite pronounced, and that can also speak to both dehydration and malnutrition. So just looking at different things. But again, temp. Okay, so I take a temperature, a rectal temperature. I don't like an armpit temperature. I don't think it's very helpful. Other people will disagree with me. However, when you get a kitten that's that age, you might not be able to get a temperature on it. It might be too small for the thermometer you have. And in that case, feel extremities. Are the feet cold? Are the ears cold? Is the nose cold? And then the next thing I do is I weigh them. Because part of monitoring, oh, that's a chunkier monkey, or a fat belly, potentially, and not a chunkier monkey, but I can see some milk on the mouth. Getting a weight is a really good way to track how you're hydrating. And then I assess I continue to assess for dehydration. I touch the gums. Are they sticky? Are they dry? I look at the skin on the belly. And one thing that you can do at home is that, you can get urine strips online that measure what's called the urine specific gravity. And that's the concentration of urine. And kitten urine is normally quite dilute. See, I'm bringing up things that I've never told you before.
I know. I'm like, why didn't you tell me this before? I want that. That sounds cool. We'll talk after.
Okay. I've got an easier thing for you. It's a little more expensive. But you can get urine strips, and it's very easy to stimulate a kitten. And now, because kittens' kidneys are underdeveloped, their urine is naturally very dilute. So if you stimulate a kitten to urinate and you get a little dribble of urine on this part of the strip that says urine specific gravity, if it's greater than 1.017, so we call that 1017, then it means they're dehydrated. Okay? So that's like a more skillful way of
I just
telling,
always go by color. Like if it's really concentrated looking.
Right. So that deep red color in the mouth, that's more of a sign of dehydration. And, skin tenting is not a great way of looking at these guys because they've got lots of extra skin and their body composition is different from cats or adult animals. And you can't really tell if their eyes are sunken if those eyes aren't open. So, blood sugar is another one that I like to get. You are not necessarily going to be able to assess that at home with a monitor, but what you can do is look for things like, is this kitten comatose or semi-comatose? Is it moving around? Does it have a lot of vim and vigor? Or is it really lethargic? Another thing in a little bit older kittens is the jaw will get clamped down really hard. They'll clamp down their jaw and they'll start to drool if they're on that sort of borderline, I'm going to go into a coma, hypoglycemia. So there are those things you can look out for. And then nutrition status, emaciation, starvation. So, like we're talking about the sort of angled jaw, being quite a skinny body, being able to really feel all the bones. When you feel a normal kitten, they're plump, they're smushy, they feel like
Hmm.
just they feel like a certain kind of squishy deliciousness that often these
Yeah, yeah,
dehydrated, malnourished babies don't feel. So that's,
yeah.
I mean, that's what I do to assess them. Yeah, that looks like a
And then in terms of like their order of operations for care, something that you've said before to me is your order of operations is like a recipe book that, like, if you're making a cake, you don't like put the raw ingredients in the oven first and then mix them after. Like you mix them first and then you put them in the oven, and the order in which you do things really makes a difference. So like one thing that I think a lot of people don't think about is the importance of making sure they're warm before you feed them, for instance, or making sure that you're not taking a kitten who's in hypoglycemic shock and putting them in a bath and washing them when, there's something else that you need to do. So, like with these kittens, you can see in these pictures, like I'm bathing them, but I'm always like so cautious about like, okay, when is it the right time? Like how do you know when it's the right time that you can feed a kitten? How do you know when it's the right time that you can bathe a kitten? Can you talk a little bit about like that recipe? Like what comes first? Warmth, then food, then bath, or warmth, then bath, then, talk about that.
yeah, that is super important. And the first and most important rule is never feed a cold kitten. Okay. Because you're actually going to shoot yourself in the foot by doing that. So the most important thing is addressing temperature and addressing blood sugar, and potentially addressing hydration. So I know that's three things that I'm saying are the most important things, but warming them up, and you can use subcutaneous fluids to warm them up,
Mm-hmm.
while addressing hydration at the same time.
Right.
So you want to make sure that you're addressing vital body systems first before you're like, oh, it's dirty. We got to get these fleas out.
Sure.
Because the fleas
Yeah.
are not going to, but the hypothermia is going to kill it. The fleas
Yeah.
long term are going to kill it because they're going to suck their blood. So
Right.
what I do again, check temperature. Okay, we've got to adjust the temperature. Is it dehydrated? Yes. We're going to address temperature and dehydration together. So I'm going to warm the incubator. I'm going to set my ambient temperature higher, around, in the 90s. I'm going to start giving warm subcutaneous fluids. We don't want to warm too quickly because obviously you can actually destroy internal organs and cause organ damage by increasing body temperature too fast.
So, like with these babies, I always love hearing confirmation that you like the way that I'm doing things, because that is exactly what, with these babies in particular. Like I got them home, put them in the incubator immediately, and then the first thing was 3 of them were very dehydrated. So like doing a small amount of fluids for them, and then once they were more like wiggly and happy and moving around and seemed hydrated, then I'm like, okay, let's get a little food in you and let's get all these eggs off your head, which was like disgusting. But I want to backtrack to something that you talked about, which is hypoglycemia. I know that I've got a couple photos of you working with hypoglycemic kittens, and I want to know, like, how common is that in kittens? How can people like recognize that's going on? And you mentioned people can give them some sugar water, but what do you do in a veterinary setting when you have a kitten who comes in hypoglycemic? What are the signs and how do you react?
So most kittens that are hypothermic are also hypoglycemic. Uh, I would I would say probably 85 to 90% of them are. Now there's varying degrees of hypoglycemia. So I usually get brought the kittens that are cold, who feel cold to the touch, who are laying there, not moving around. And so for me, getting sugar into them is critical. So as a veterinarian, usually in that state, they're so dehydrated and shut down that I give an injection of dextrose into the abdomen, and it gets absorbed by the gastrointestinal tract. And I also give fluids that way, and I also give fluids under the skin. And then I start my warming process. And so the body's going to absorb sugar, and it's going to absorb fluids, and that's little Lucifer. And she came in hypoglycemic, and so once we were able to get her to the point where she had a vein, because she wasn't so collapsed, we were able to place an IV catheter and get a constant rate of dextrose fluids going into her. In neonates, sometimes we'll place a catheter right into the bone, and that's called intraosseous, and we can give sugar and water, or sugar and saline, directly that way. But in the clinic,
Pretty amazing.
when we get kittens who are so hypothermic and hypoglycemic, it's really critical that they get on an IV drip. And it sort of begs the question is, why are they so hypoglycemic? And oftentimes it's due to an underlying illness.
So I want to move on a little bit. I have a question for you about temperature regulation in kittens, which is, we know that young kittens obviously cannot thermoregulate. They rely on, cuddling up to mom like these little guys are down there, or they rely on, an external heat source like an incubator or a heat pad or something like that. Can you talk about, as they get older, they are better equipped to thermoregulate. What is physiologically causing them to not be able to thermoregulate as a baby? And then what changes about their physiology that allows them to thermoregulate once they're closer to like 4 weeks? What happens?
So initially, kittens are born with about a 24-hour fat store. Okay, and it comes in the form of glycogen, which is like fast sugar, and the body can use that to not only feed itself and give them sugar, but using the sugar actually heats the body. Okay, and once that sugar is gone, and it can be depleted so quickly. I know I say 24 hours, but that goes by really fast in cases of poor nutrition. Then there's no more energy for the body to make into heat. And because the liver is underdeveloped in a kitten, just like most of its organs, it can't say, I'm going to take a little extra you got here on your thighs, and I'm going to turn it into energy for you. Because the process of turning body supply into energy creates heat. So that's one of the reasons why kittens can't properly generate heat. Another thing is reflexes haven't developed. So the reflex to shiver when you're cold, that's a heat generating reflex. Kittens don't have that. And when we go back to the liver too, the liver can take extra food that you're feeding them, turn that into fat stores, and then those fat stores, again, as they get burned up, like some fat stores are actually just there to produce heat. But kittens under 4 weeks of age don't have that ability, or have a really compromised ability to do that, and as such, they don't keep themselves warm.
Really, really interesting. So another thing I wanted to ask you about is a common issue I see with new bottle feeders, which is, when people are bottle feeding a kitten and they don't have a lot of experience, or they haven't, attended a online webinar or something like that, they oftentimes can end up with a kitten who aspirates. And aspiration is a major killer of kittens. You and I both know how difficult that can be for them. I want you to talk a little bit about the dangers of aspiration, what's actually happening in the body when they're going through that, and what's the best thing to do if a kitten does experience that. How should people react right away? And I know I have some pictures of bottle babies that we can show for this is some babies that you sent along to me. It's just so important for people to be feeding them in a way that is safe for them. So can you talk a little about that importance and what to do if a kitten does aspirate?
For sure. So anyone who's seen your tutorials knows proper feeding position, proper nipple use, and if they can't use a nipple, how to negate that. But that being said, even if we do everything correctly, sometimes kittens do aspirate. And what that means is, yeah, proper feeding position, perfect, is that they inhale the milk into their lungs. And so that airway is a series of tubes that lead all the way through the lungs. And it should be filled with air so that air can go into the red blood cells that are in the lungs. And then the carbon dioxide that's, old and sitting in the red blood cells can be exchanged and come out of those tubes. But when you fill or even get some fluid into those tubes, then you compromise the lungs' ability to perform oxygen exchange. And if the lungs are filled with fluid, they become like wet sponges. And unfortunately, you can't suck fluid out of the lungs. And so what happens is sometimes those lungs collapse upon themselves. The good news is that lungs are made up of two sides and several lobes, so it's not the end of the world. You still have some breathing capacity, but it is very, very dangerous. So if you start to see signs of your kitten aspirating, so starts coughing, or milk starts coming out the nose, or you start to hear this little rattle, I don't know, are there any other signs that you tend to notice with aspiration? You probably don't aspirate kittens very much.
I mean, I see with kittens sometimes, like, if they aspirate, they'll kind of like they're trying to deal with that's there's something that's gone up into their nasal cavity. And then of course, when I get kittens who have like a rattly chest already, then I'm like, oh dear, you can kind of feel when you're holding them, it's almost like there's like a change can inside of them rattling around, and that is not right. So I kind of wonder, like, if you see somebody, if you see a kitten aspirate in front of you, what's the first thing that you do? And then do you get that kitten on an antibiotic right away, or do you wait? What would you say?
So usually what I'll do is, remove the bottle from their mouth, and I hold the kitten at an angle sort of downwards to try to allow things to drain, out. I'll tend to sort of pat the back or pat the chest. I'll also take, I'll take a piece of gauze or a little towel, and I'll squeeze the nostrils like this to try to get any residual sort of milk out of the nose. I'll use a bulb sucker or a syringe, and I'll try to squeeze out anything in the back of the throat and just take it away to not overburden them. And I'll sort of just, and then I'll often just hang them for a little bit, not hang them, but just sort of keep them at a little bit of a downward angle for a minute or so, and allow anything that they're coughing out to just have the benefit of gravity to come out.
Sure. Sure.
And then depending on the degree of aspiration is how I decide if we're going to start antibiotics or not. I've had plenty of kittens who have coughed, or I was worried about aspiration in them, that I didn't start antibiotics on. And I just made sure that we took feeding nice and slow. I made sure to tap their chests every once in a while. So if you take your hands and you sort of cup their chest and you just very gently tap them, it helps sort of rattle the chest and bring junk up from the lungs. Um,
Right.
Moisturizing the airways at home is something that you can do. So either with a nebulizer and saline, or running a steam shower and then going into the bathroom for about 15 minutes. That helps to loosen any sort of secretions that have become thickened because maybe an ammonia is developing, and helps the cat to be able to cough them up. Now, if you
Right.
start to hear or feel a chest rattle, absolutely 100% take them to a vet. You're going to want to get them on antibiotics, because there's a lot of
Okay.
opportunistic bacteria who will take that situation and say, I'm going to colonize here and I'm going to really try to make you very sick.
Sure. Yeah. Oh my gosh. I have so many things I want to ask you about. One thing that I want to make sure we touch on is about sort of the development of the immune system in kittens, because, of course, kittens are at higher risk for medical conditions for a lot of different reasons. I mean, one, they're very small. Two, their care is sometimes more complex than people are trained to deal with. And then three, it's like they have these underdeveloped immune systems, and especially if they are an orphan. So I was wondering if you could talk a bit about, because like the kittens on the kitten cam, they came in as orphans on like their first day of life. And then on their second day of life, we found mom. And I was so happy that they got to be connected to mom. But I know that there is a significant difference in, bottle raised kittens and mama raised kittens in terms of their immune system. And, there's a lot of different ways that we can mitigate all of that. So can you talk about how does the immune system develop in a neonatal kitten, and what are the differences between, bottle raised and mama raised kittens?
Sure. So a kitten, apparently, and this is an old statistic, so I don't know how true it is or relevant it is, but the old line of thinking was a kitten gets up to 25% of its antibodies, which, is its protection for the first 12 weeks of life, from mom's placenta, or from their placenta from mom. And I think that it's going to depend upon whether that was an assisted birth versus mom doing it herself at the slow pace where the placenta's attached for a little bit and she's grooming them and that kind of stuff. But apparently, they can get up to 25% of maternal antibodies. The rest of the maternal antibodies have to come from the first milk that moms produce, which is colostrum. And it's only able to happen within the first few hours of life because kittens have a leaky gut. And it's leaky enough to allow those big immunoglobulins that make up sort of antibodies to leak through the kitten's gut into the body. And they say the first 24 hours of life is when you can, when you have that open window, but we're actually seeing it's shorter. It's actually 12 or less, and ideal is under 8 hours. So getting a really good suckle of colostrum or milk and having a good nurse is really critical to having kittens develop the immune system. And everybody, I feel like, who sees a kitten come out and, let's say it's a C-section or a mom comes in and is whelping, everybody's first response is, oh, I should take care of it. That one's struggling. I don't think it's nursing as well. I want to feed it. I want to do this. And the best thing you can do is keeping it on mom. And there are other things that can help with developing the immune system, but maternal antibodies are pretty much the biggest and most important thing we have. And you can test for maternal antibodies if you're not sure by actually testing a tiny little blood to test a couple of liver enzymes. And those enzymes will be thousands times higher in kittens who have gotten maternal antibodies.
That's interesting. And then,
Because
of course, when kittens are a little bit older, they, are then able to get vaccinated, and that is another way that we can help with their immune development. But, I know that there's this really interesting sort of wave of like, you want to be careful about maternal antibodies interfering with the vaccines, and you want to vaccinate at just the right time, but not have the kitten become exposed to potential things. Can you talk about vaccination in kittens and like what your recommendations are for people with regard to kind of those ways that as kittens grow, we're able to give them some immune support in that way?
Sure. So having an underdeveloped immune system means that you have to nurture it. And there's lots of ways to nurture it. And one of the ways of nurturing it is through vaccination. If you have mom while she's pregnant, vaccinating her is critical to giving her those antibodies that she can pass along to babies. So there's all this fear about vaccinating cats with the FERCP vaccine while they're pregnant. It's actually a really, really beneficial thing you can do because it allows them to build their own antibodies and then transfer through colostrum to the babies. So that's the first thing. For the first 8 weeks for certain, kittens have maternal antibodies, the kittens that got colostrum, okay? And so there's not really a benefit to vaccinating prior to that time because kittens have these maternal antibodies and won't necessarily generate their own new antibodies to what you're vaccinating them for. Also, the immune system at that point is not greatly developed enough to properly start to develop those antibodies. That being said, if you have kittens in a high-risk situation, like you have a shelter or you have a kitten nursery and there is disease exposure in your home, then vaccinating as early as 4 weeks old, as soon as kittens are on solid food, is gold standard. So it's really, really situation dependent. And the other thing too is boosting those vaccines in an appropriate time frame. Don't let them go more than 3 to 4 weeks between vaccines, because otherwise the first vaccine isn't going to do anything. It's not going to trigger the second vaccine and the immune system to build those antibodies. But on this topic of nurturing the immune system, things that we can do to nurture it are my favorite, probiotics. So we'll get into that in a second.
I have a question about that for you.
Really making sure that we practice good husbandry, okay? Supportive care, so clean environments, warm temperatures, keeping the body temperature, appropriate. Practicing really good handling of food products, not leaving formula out and sitting and developing bacteria. Washing your hands before handling kittens. Proper sanitation of the environment.
This is all stuff that I'm about to ask you about. It's so funny. You're like bringing everything up that I'm like, oh yeah, that is what I want to talk about, because there's so much that goes into a healthy kitten that is not just taking them to the vet. It's also like the environment that you're even raising them in. A thing that I wanted to ask you about is, I know you always talk about how a huge portion of the immune system is in the gut. And, we have these little kittens who come here who obviously struggle with external issues as well. Things like, parasites that have gotten into them, things that have come in that are, either bacterial or parasitic, that are messing up their gut, but there's also just the environment of the gut. These kittens sometimes have a very hard time just absorbing nutrients. Their poop comes out looking the same that it looked when the food was going in, and you're like, that doesn't look right. So I would love for you to talk about, the gut environment for these kittens. How can we understand what's going on in their gut, and then how can we create like a really healthy GI environment for our babies?
Right. So it depends on what age the kitten is. But if we have a newborn, newborns have a sterile gastrointestinal tract. It is a complete blank slate. And what happens in those first few hours determines whether we get the right bacterial combination going or we mess it up. And then we have problems. And I would say for most people who are in rehab, not in rehab, but are rehabbers of kittens, usually don't get that opportunity. Okay, so you usually get the kittens and they're already in a sorry state, and they're, somebody's already put them in a poopy environment, or they've been born into a gross environment,
Right.
So what we have to do is we have to try to give them those good gut bacteria things. And one of the things is my favorite, probiotics that are specific to kittens, because what we know from research is that kittens and dogs too have a much higher requirement of different bacteria than what humans do. So don't go to the fridge, don't reach for your probiotic and pour that capsule into their milk and give it to them. You're not going to help them.
Don't go get like a bunch of yogurt from your refrigerator and feed it to your babies or something. Yeah, I wanted to call out, I do have some photos here of little Lucy, who you were really helpful with when I had Lucy going through all of that. I mean, she has a whole lot of problems, or had a whole lot of problems going on, but one of her issues was like her gut was just terrible. And so probiotics were really, really helpful for her, and it was like a whole adventure getting her gut stable and getting her poop looking right. But you have really influenced me in terms of, oh, look at her little teeth. In terms of like, understanding how important it is to get, to get their gut right.
Yeah. And that being said, you can overdo probiotics, because what we have to remember is the gut is made up of bacteria. And in a healthy animal, it's healthy bacteria. In an unhealthy animal, it's an overgrowth of bacteria that we don't necessarily want there. But that being said, it's something, oh gosh, she's so cute. It's something that has to be in the right proportion. And so probiotic is definitely a help for that. Good nutrition, eliminating the bacteria, the bad bacteria sources to the best of your ability. So don't leave milk sitting on the counter for 12 hours and then expect that that's going to be good on the gut and not give yucky bacteria. Just want to eat her. She's so cute.
Yeah.
And then,
I mean,
so
go ahead.
Sorry, go ahead.
No, you finish.
Okay. But basically nurturing that bacteria, because over 70% of your gastrointestinal system, over 70% of your immune health exists in your gastrointestinal system, and is because of the bacteria that's there. And so making sure that we give that bacteria the ability to have a happy environment and a happy home and the ability to survive is critical. And the other thing too is that a lot of times we'll have to put sick kittens on antibiotics. Well, antibiotics kill bacteria, but they're not necessarily choosy, and they'll kill both good bacteria and bad bacteria. So making sure that we are giving kittens that good bacteria back to utilize is really important for immune support.
Yeah, I always think of it as like a balance. So anytime you have anti, you also need to have probiotics so that you're like balancing everything and making sure that they're doing okay. I really liked that you brought up like the husbandry piece of this because that is huge. I think that when people get involved in fostering kittens, they expect, oh, I'm going to like wipe some butts and, feed some bottles or whatever it is. But I don't think they realize I spend like half of my day just sanitizing, like cleaning the tables, spraying down the incubators, like sanitizing the food dishes, every single thing. I know I have a video I can pull up that's like, yeah, this is, and it looks much faster in hyperspeed, but it is like, I'm just constantly sanitizing. And I think that you have better outcomes when you are giving them that like, sterile environment. So can you talk about like some of the things that people might not be thinking when they're, making sure that there's Coco. Coco's always by my side. When people are doing their, disinfecting, what do people need to know about that, and how much of a impact does that make on their health? Because I don't know that people always think that, spraying down your countertops actually could lead to better outcomes for your kittens.
For sure. Spraying down your countertops, sterilizing your bottles. How many people sterilize their bottles? And yet, how many people with human babies do you know? And a bottle sterilizer is like one of the things that they have in their home and is like a necessity.
And you can use the human baby sterilizer for kitten bottles.
You can. So, but also, knowing that kitten bottles are plastic, which means they're porous, and that can also, like, that holds on to bacteria. So things that are really key are food preparation and storage and sanitizing of the things you use, cleaning feces, and even things that you wouldn't think have feces or fecal matter on them really do.
Poop is everywhere. It's everywhere.
And honestly, if you were to come to, your kitten room or my kitten room, and we took a swab and we sent it off to the lab, 100% it would grow stuff. So
that makes me so sad. I try so hard, but it's like, yeah. I mean, it's crazy too, because with kittens, they just, sometimes you get new kittens, you put them in the room's sparkly clean, you leave the room, 10 minutes later you come back, there's like poop spray painted on the wall, and you're like, oh my gosh, this is crazy. So yeah, I mean, like sanitizing everything and doing it right away, because, one thing that I think people don't realize is if your kittens have like coccidia and they are spray painting your walls with their stool, and then you're treating them for the coccidia, but you're not cleaning, they could just be reinfecting themselves. So we want to keep everything super, super clean. I think now is, go ahead.
No, sorry. Making sure you're not reinfecting is really, really critical, but also making sure that you're using the appropriate type of cleaner. So right now, our clinic, and I know you used Rescue, which you can get, unless you don't use it anymore.
No, I do.
But you can get it on Amazon. You can get it from your local veterinarian office. They make the Rescue wipes. They're rough on the hands, so we should wear gloves if you're using them. Or you can use a 1 to 10 bleach dilution. So 1 part bleach, 10 parts water, and that will also kill parasitic cysts, eggs, whatever. But making sure that you're following the instructions, so that if you're using Rescue and it says, let it sit for 10 minutes before cleaning it off, let it sit for 10 minutes.
Actually do what you're meant to do. Same with like following instructions with bleach. I think, read the instruction, read the manual, people. It's out there. Another thing that I wanted to touch on, because I do think people are during this pandemic, people are a little bit more aware of like, oh, I should be sanitizing things. I should be thoughtful about what contagions could be in the environment. But the other thing, obviously, that people are doing right now is like social distancing, self quarantining. And I'm sure it's been the same experience for you, like that it has been for me, which is you're watching people have to learn how to do this stuff. And we're like, oh, we do this all the time. Like, we do this with cats because when you're a vet or a foster home, I mean, you're constantly seeing animals with unknown health history, and you treat them just like you would another person that you don't know right now, where you're like, I'm going to assume that you could have some illness going on. I'm not going to just like, let my cat lick your butt right now. Like, we got to figure out what's going on with you. We got to do a little bit of quarantine. I've been calling it like social distancing for foster kittens. Like, be careful. So I would love for you to touch on that. And like, when people are fostering and they're bringing home a new kitten, and they have their own resident cats, how do you, because it's just like with the pandemic that we're going through right now, everybody has a different place they draw the line. I'm very firm. Like, I'm like, stay away from me, put on a mask, put on gloves, like, don't breathe in my space. Like, nobody comes in my house right now. But yet there's ways to kind of like do this cost risk analysis, right? So like, where do you draw the line, and how do you figure out like, when is it the right time to let your resident cat meet a kitten, and when is it like, this is not safe?
Yeah. So as I'm
she brought a kitten back. Did you see that?
Oh God.
That was cute. I've never seen her do that. She like went, one of them wandered off, and she was like, get back here. You're my baby. That is so, sorry. I asked you a question and immediately interrupted you, but that was really cute.
No, that's totally.
There you go, Mama. Oh my gosh. Oh gosh. Okay, I don't even remember what you're talking about now. Bringing home foster kittens and introducing them to your cat.
God, she's cute. So I am more lax than most people. Not always to the benefit of the animals, but it's what I interpret to be benefit versus a con or a risk or something. So I definitely am of the type who, in an ideal situation, my kittens spend 2 weeks apart. Before I'm going to potentially before I'm potentially going to introduce them to other kittens. Actually, so this is baby James, and James was found up on a roof, which is why she was named after James Taylor from the song "Up on a Roof." Okay, I'm probably eating myself real bad right
now. No, not at all.
19, okay? I swear. But James came in. She had been found on someone's roof. I don't know how she got there, maybe a hawk or something. And she had pus coming out of her eyeballs. And she was like, she was just a mess. And this is after like 3 days of me cleaning her eyeballs, eye drops, treating her with probiotics, because everything that comes into my care gets probiotics immediately. But James was sort of like, I'll do okay, but I don't really want to eat. Like, I'm not the greatest eater, and I feel really sad. And I was like, maybe you need a cat mom. And there are things that I can't provide emotionally that a cat can. And I wish that I could. I wish I just like oozed those pheromones and that kind of stuff. But like, I sort of equated, and there's my cat Charlotte, giving her a bath and like playing with her, and James freaking thrived. But I had to take the risk and say, okay, what am I worried about? Well, I'm worried about herpes virus. That's the first one. 70% of cats, though, who have come from shelters have herpes virus, and it's latent in their system. Well, guess where Charlotte came from? In shelter. I'm worried about calicivirus. Well, if you vaccinate your cats appropriately, you vaccinate them for calicivirus. Charlotte's completely vaccinated. I'm worried about some other viral respiratory infection that Charlotte is naive to, that she's never been exposed to. But the good news is she's a healthy adult cat. She's fully vaccinated. She has a pretty good immune system. And if she catches the sniffles, then I will make sure that she gets appropriate veterinary care to overcome that. So I felt like my risks versus rewards chart showed the risks here and the rewards like up here. So for me, that was something I would do. But that being said, so good.
Yeah, I think that it's so great that you kind of mention and look at, oh my God, I can't stop looking at these little babies crawling all over the mom. I think, you're totally spot on that it's different depending on the situation, and that's why it is important to be able to, make those decisions. I definitely fall personally on the 2 week, I want to see 2 weeks of a healthy kitten. But I do think that, it all depends on your resources. Are your cats vaccinated? Are you able to provide them with, appropriate care? Is this a kitten who is at a critical socialization age and they're all alone and they're going to stay alone? I have some photos of actually the kittens who are behind you in your picture, Spinach and Chickpea, when they first came to me. They were little babies that were separated. They were orphan solo babies, and they met each other through a wall. But I would not, there they are. I wouldn't let them, snuggle at first because I didn't know. They had a lot of problems. Each of them had their own problems going on. And I was like, I just want to wait 2 weeks. When they met each other, of course, it was the cutest thing ever. They were really confused and what? There's other feline life out there? And of course, they became best friends. And that really was an important relationship for them. But, it is all about deciding, when is the right time. And anything else that you want to say about that?
Yeah, in an ideal world, and I do practice this, and again, it's really situation dependent, and this is the thing with, I'd like to say modern kitten medicine, is that we're treating these guys as individuals and these situations as individual situations rather than just being like, there's a broad blanket rule that applies for everyone. But my broad blanket rule, which I break a lot based on the situation, is all in, all out. Meaning, if I get a litter of kittens, they are that litter of kittens all together. They grow up together. Nobody is introduced to their group, and they are adopted out. And there's not a straggler that gets put in, because that's the ideal. They all have been exposed to the same bugs. They all have the same antibodies to the same things. They all are carriers of the same things, and they get to keep it within their circle. And I don't expose it.
Yeah, it's sort of like the same thing that we're all going through right now, where it's hang out with your little pod of your people and don't go making a bunch of new friends during a pandemic, unless you're literally alone, and then maybe it's okay to make one friend so you have a friend, right? And that's, I think, my experience a lot is with these little kittens who are solo. They do benefit from having a friend, but you just, you're cautious about how you do it.
You just have to just accept risk versus reward. And if your kitten is not doing well by itself, then you have to give it a kitten. Mm-hmm. And you can try.
Sometimes kittens need a kitten.
Right. And sometimes kittens need an adult cat. And the benefit for me of an adult cat is the already developed immune system and being fully vaccinated, and the fact that I'm using regular deworming on my pet, so that, because I know my cat licks buttholes. I know she does. You know, it's just not,
No, Coco would never.
well, we are as classy here at the Wallach residence, but only for really good intentions. And
Yeah.
but I know she does those things, so I make sure to take care of those things. And also the linens gets changed frequently, that kind of stuff. But it's
Mm-hmm.
really about risk versus reward. But please don't be that person who's like, I can take on more, and I can take on more, and I can take on more, and then we're just in this one big playpen in one room, and then suddenly we have 20 panleukopenia kittens. And I see that way too often.
Best intentions, but
Yeah, but the road to
yeah.
hell is paved with intentions, as they say.
Mm-hmm.
And
Mm-hmm.
I don't want that.
Yeah.
Nobody benefits from 20 kittens dying of panleuk. Nobody.
Right.
Um,
Yeah, I
even
think
with,
that that's totally why having good boundaries is a really big part of kitten care, knowing what you can take on and what you can't take on. And, when I'm caring for a bunch of little solo orphan babies or a bunch of little orphans like these guys were, then I'm like, I can't take on more because I know I have all this work to do. Now that they have a mom, I'm going, maybe mom's going to do a lot of work. So maybe I could take on some more and put them in a different space, wash my hands, social distancing for kittens, all of that.
and
Um,
have some for
so I want to talk about the kitten that I just pulled up, which is Spinach. Spinach is a really special kitten a lot of people fell in love with. Of course, you and I both fell in love with. And you did just an amazing job working with Spinach. So I have a video that I was going to play just to show a little bit about Spinach's case, and then I know she's like becoming a better mom in front of my eyes right now. It is cool. Look at her. She's figuring it out. It's awesome. Oh
eating
gosh.
kittens
I think she's
produces
licking their butts.
She is.
Oh,
Total
you
reward.
don't know the joy that this brings me because I've been, well, not the butt licker, but I've been the butt cleaner. So if she's going to be the butt cleaner, then that relieves me of some of my duties, which makes me really happy. So let's talk about Spinach because you did a great job working with Spinach, and I want to play a little video and then we'll talk about Spinach's case. So let's watch it together. Not only was Spinach's chest misshapen, but there was actually a free-floating bone at the bottom of her sternum, and it was pointed upwards towards her heart. This was like a ticking time bomb. My veterinarian sent it along to a surgeon who agreed that this was really urgent and that she needed to have emergency surgery right away. So Spinach was only 3 weeks old and under a pound when she had to go immediately over to the vet hospital for a procedure. The two vets worked together and they came up with a plan that involved sewing down into her rib cage and pulling the bones forward by attaching them to an external chest plate. So what they would do is actually fix a chest plate onto the outside of her body that would be attached and pulling those bones forward, kind of creating more space for her heart and her lungs, bringing that rib cage forward, and also attaching that free-floating piece so that the whole thing is one properly shaped rib cage. This is a really dangerous procedure, especially in a kitten who's so small and so young. They had to get creative about what to use to make that external chest plate. So they actually took a large syringe and cut it and drilled into it, and that was what she would wear on her chest. And at the end of it, she looked amazing. These vets are truly miracle workers. Dr. Rachel and Dr. Norris together gave her such an incredible gift. I mean, I want to cry every single time I see that because I remember, and I'm like, look at me, I'm such a dork. I'm like, I was so emotional about this case because I had never had a kitten who had pectus excavatum before, and she was so young, she was so small. I know I have a picture of you like the first time that you met her, and you just like jumped right in and you were like, I'm gonna work with this kitten. So I want you to talk a little bit about these types of really special cases, these special cases where a kitten has a congenital malformation or some kind of ailment that's really like a unique special case. A lot of these kittens, you know, have in the past and still to this day sometimes been seen as unadoptable or untreatable. And I love that you have this attitude of just like jumping in and trying. Can you talk about like what was it like working with a kitten so small with such a severe condition, and what kinds of extra precautions go into doing surgery on such a young kitten? Talk a little bit about her case.
Sure. So, I felt really bad because you were like, oh, I'm thinking about getting this pectus kitten, and I was like, get her, go get her. And then you agreed to get her, and then sent me the X-rays, and I was like, and I was like, yeah, can I just go get her? And then and like, I'm sure it'll be great. And then I was like, bone, right, going towards the heart. Okay, so first of all, these are the cases that I've lived for. You know, as much as I love, as much as I love, neonates and that kind of stuff, it's the stuff that makes you work hard and try to do your best and to try to do good work. So for spinach, and you can see we have kitten masks. That's my cutest mask. And and we take these extra precautions for kittens. But when we saw what was going on with spinach, and I always consult, not I shouldn't say always, but I majority of the time consult with a board certified surgeon, who is a really great mentor to me. She agreed that surgery had to happen sooner rather than later. And the beauty of kittens, even though they're tiny and they have increased risks and different needs, is that their bodies are made of rubber. So all their bones are cartilage. So they're really easy to reshape at this point in time. And they heal so fast and they're so resilient. And so it's one of the things I love about them. And the other thing too was, you were talking about before taking on spinach was, a friend's kitten who had had the same condition and then decompensated very quickly and didn't do very well. And in spinach's case, because of her size, we were able to know that we would actually have less of that risk. The risk of there's a risk of the lungs developing fluid as you expand the chest cavity. But because her chest cavity was so small, we weren't going to be expanding that much, and she was so young, we knew that we actually had a decreased risk. So, on the one hand, that really played to her favor. So, I I was basically like, we got to do surgery. We got to do it now. And I understand the risks that was. God, she's so cute.
I know.
And the one thing I think that people forget about veterinarians in the first place is that we are required to wear a million hats. You go to vet school, you learn how to treat like 7 species plus a bit of knowledge about all these other things, and then you're expected to be a surgeon, you're expected to be an OBGYN, you're expected to be a neurologist and know about skin and know about all these things, and you're like, I'm a human. How can I know about all these things? And like, how can I be an expert at all these things? And the answer is you can't. You can't, but the things that you do know about and feel comfortable about, you can try to do your best. And for me, I love surgery specifically, because we know what risks are going to happen, We know what risks we can control, and so we control all the things we can control, so that all we have to deal with are the things we can't control, and that
Right.
for me makes it easier. Now, a lot of vets are also afraid to do surgery in general. Surgery is not something that everybody loves to do. And that's okay. But if you love doing surgery, plus you love a challenge, then spinach was an awesome case for that.
Right.
Now,
Yeah,
imagine not,
I appreciate. Go ahead.
oh, I said, now imagine not loving surgery and then knowing that kittens who weigh less than 2 kilograms, so that's less than 4.4 pounds, have a 16% increased risk of anesthetic death. Okay, so
Mm-hmm.
first of all, you're doing a risky procedure. You're touching the chest cavity. That needle that we were sewing into her chest could have touched her heart, could have poked her heart, and she already has very specific anesthetic needs that thankfully I know about, because this is the area that I really like to learn about and sort of pride myself on researching and
Mm-hmm.
knowing. But she has very specific needs, so it's a very scary thing, I think, for most people to want to do surgery on a kitten. Their heart's not
Right.
fully developed, kidneys aren't fully developed, they're not good at maintaining their blood sugar, they have certain medications that will just kill them. Um, so yeah, it's not so sweet.
But you know what? I think what's great is that you have, developed the experience and the, like knowledge and also the relationships with other specialists who can help with some of these like very unique situations. You are, able to show what is possible, and that's something that I know both of us are really passionate about, is showing that some of these cases that people say are untreatable, we actually just don't know until we try. And sometimes you try and it doesn't work out, and sometimes you try and it does. And then you kind of find that actually some of these kittens really can be saved, even though they have these challenges. A thing that I love that you say is you always say there's no such thing as unadoptable. And I would love if we could kind of wrap up on that thought. Like, what do you mean when you say there's no such thing as unadoptable? And how can we be pushing the sheltering world, the veterinary world, the whole cat community to broaden their idea of what an adoptable kitten is?
I think it comes from us as a community of cat lovers and of people who view cats as valuable, because unfortunately our world is revolves around what we decide is a commodity or valuable. And so the only reason a cat is considered less valuable or less worth experiencing, studying or practicing medicine on, is because for a while the world said cats not that valuable, not that important. But you have done this amazing job of creating this community of people who are like-minded and who do see the value and the importance of cats. And if we continue to do that and to push forward and say, it's not appropriate for you to treat them more, um, not more, it's not appropriate for you to treat them poorly or to give them less of a chance because you see them as less valuable. And if we just come and we keep advocating, it's consumer demand. And I hate calling it consumer, but it really is. It's client demand, it's owner demand, it's animal lover demand, but the demand for medicine and for people to pay for it because unfortunately medicine costs money. But having that drive to have good quality medicine and care and knowledge comes from us and that push forward.
I really appreciate what you just said, and I really feel that you know, when I work with a veterinarian, when I work with a new veterinarian, to me, like a vet that I've never worked with before, I feel like I have to go in just setting the stage a little bit and saying, like, I want you to understand, like, these animals have significant value to me, to an entire community, and like, we're gonna treat them like we would treat if it was my own child, you know. And I think that that's the beauty of the work that you are doing with these little special ones, is when you do treat them with that dignity, that value, you know, that real intrinsic value, just because you are a sentient being worthy of a chance. When you treat them like that, you see that they can thrive. And it is a really cool thing to be able to do. And I'm so appreciative that you have played a huge role in making that happen for my kittens. I know I can always call you at midnight and talk to you about poop, and you are not even unhappy to hear from me. You're like, ooh, send me pictures. I'm so excited to talk to you about this poop. So you're really, really making a difference for them, and I'm so appreciative of you. I have just one last question for you, and it's a silly question. And this is based on the idea that, like, you will kind of take on anything, right? Like, you'll take on, you know, when you said you get the box and you're like, ooh, what's in the box? So this is my would you rather question for you. Would you rather open that box and find that you have been tasked with caring for a kitten who has 3 heads? Or would you rather open the box and find that you have been tasked with caring for a kitten who has 12 legs? And why?
I mean, 3 heads for sure. 3 heads.
Why?
Because look at the eyes. Like, I just feel like I'm definitely an eye person. Like, I definitely feel like my connection to people, to animals, to anything is made through eyes. Which, don't get me wrong, I have an eyeless kitten, so like, we still have a very good connection. But I just feel like they stare into your soul, and like that is so important. But also, can you imagine if like one was a demon and like one was the sweetest thing and like one was who knows, and you're like trying to just give so much love to this sweet kitten, and this other kitten is like attacking the crap out of you, and you're just like, how do I do, you know? And also, I think I would really be interested, like, do they all have their own hearts? Or, like, do they, like, from the medical standpoint, I'm like, ooh, do they have, like, upper body that are different? And, like, could I medicate the really sweet kitten and it travels through the bloodstream to, like, treat the really nasty kitten, you know? Like, it's more like morbid curiosity.
I knew you would have some curiosity around this one, and I love that. I mean, I kind of think maybe if they have 3 heads, it's like 3 times as much love for you, because it's 3 times more faces gazing upon you, right?
Also, I've seen kittens delivered by C-section with multiple legs, like extra legs.
Yeah, so you're like,
so I'm
12 legs, been there, done that, nothing new here. Well, I will say, if I ever get a kitten with 3 heads, you will be the first person that I call. So, well, thank you so much. I've really enjoyed talking to you, as I do all the time, but I've been really happy to be able to talk with you here and, you know, introduce all of my folks to you. So where can people find more about you? Where can they follow you? Where can they come bring you their 3-headed kittens? Where can people find you?
So I am on social media. well, first of all, I should say thank you, because you have given me such an opportunity to work with kittens and to expand my knowledge and care, and just meeting somebody who loves kittens in the way that I love kittens makes my soul happy. So thank you.
Oh.
Um, but I am on social media, so you can find me at WeVet. You'll see me on some of Hannah's posts, so you can find my Instagram handle there, and I'm on Facebook as well. And hopefully, a kitten medical care book will be coming out. I say hopefully. Hopefully, someone will see this and be like, "That girl has some information we want." But yeah, basically Instagram, and occasionally TikTok, because that's become a little bit of a new sick obsession.
I didn't know that. I don't have one and I've never looked at it, but now I'm curious. And then
I
also, if people want to bring a cat to you, if they are in Southern California, they can come to Oaks Veterinary Urgent Care. And where can people find out about your clinic?
So we also have an Instagram called oaksvetcare.com, and Facebook oaksvetcare.com, and a website www.oaksvetcare.com.
Awesome.
So
Well, thank you so much. It's been really, really fun talking to you, and I wish we could talk forever, but I'm sure we'll talk like later today, probably. I'll send you some more cuteness of the mom and babies, and thank you so much for your time. I appreciate you.
thank
Okay. Bye. Oh, we really do talk like all the time. Rachel is just a huge light in my life. So I'm so glad that she was able to come on to the program with me. Again, I want to thank Royal Canin for their partnership. I want to remind you they have a great campaign right now called the Take Your Cat to the Vet campaign. It is so important that we're taking our cats to the vet. You can learn a lot more at royalcanin.com/cathealth. You can also go on there to talk to a vet online for free through a partnership with Royal Canin and ask.vet. So definitely check that out. It's so important that we're doing right by all of our babies, whether they are, kittens that we're fostering or our adult cats at home. Also, stay tuned for next week. My guests are going to be Dr. Julie Levy and Kristen Hassan. They are both two incredible leaders in the animal sheltering industry. I'm really excited for that discussion, so please join me then. And that's all for now. So stay curious, love your cat, and join me next week on Kitten Lady and Friends. Bye, guys.